Hi, everybody. Welcome to the calendar meeting. Who's having first and all the chair tonight. It's 5:30, so we'll get underway. And I have a motion from Barry Smith to adopt the agenda, Barry.
Yes. Move to adopt the agenda for June 4th, 2024.
Can I speak after that?
Also,
No, let him do that first.
Yeah. Thanks, Barry. Any discussion by council? All in favor? Carried unanimously. And I'm going to turn the floor to CEO just for a moment.
Thank you. Through the chair, I would just like to welcome Amanda Noel, our new Director of Legislative Services and Clerk. She's in the back there. Yesterday was her first day, so trial by fire tonight. So just wanted to welcome her. And for those who don't know, Susan is retiring early July, so there'll be an overlap period for the transition. So we're excited to have her here and just welcome.
And welcome. Okay, number 3, disclosure of any interest during the hour time for the meeting, just let me know. Public meetings, we don't have any scheduled. Adoption of the minutes moved by Councilor.
That the minutes of the regular committee of the whole meeting held on May 7th, 2024 be approved.
Any discussion? All in favor? Carried unanimously. Our first delegation is Suzanne and Dr. Kniff, and if you two would like to come forward and we'll listen to your presentation. Yeah, right there, Suzanne. It's a 10-minute time limit. Nice to see you again, Dr. Kniff. Nice to see you again, Suzanne.
For inviting us to attend the meeting this evening. In 2023, the Perth Family Health Organization submitted an application for funding for an interprofessional care team. And as you are aware, we received notification of the approval of the Perth Family Health Team Organization's expression of interest in February of this year. Thank you so much for supporting the application. We are very excited to bring this model of care to Perth. Next slide, please. The interprofessional primary care team will operate out of 3 locations. A geriatrician and addiction specialist will provide care in the Elliott Street Clinic. A psychiatrist and Indigenous care navigator will provide service in Perth Family Medicine location. And the remaining 16 funded allied healthcare providers will be distributed across all 3 clinics. Next slide, please. The concept of a family health team is not new. It has been around for 20 years. Family health teams are community-centered primary care organizations whose programs and services are geared towards the population that it serves. Next slide. Ontario Health's funding goals are to increase access to comprehensive primary care that promotes health and well-being for those with a primary care provider and for those without. It also strives to ensure patients can connect with care where they need it and when they need it. It strives to remove barriers to care for people who are marginalized and or have a poor health status, meaning that everyone has a fair and just opportunity to be as healthy as possible. Additionally, they want to enhance the experience of healthcare professionals who work in the primary care settings. Supported health professionals can provide better care to patients. Most importantly, they want to improve patient experiences. A positive patient experience leads to better health outcomes and builds trust between patients and healthcare providers. Next slide. The family health team will be governed by a balanced team with complementary skill sets and a culture that allows everyone to work together to make the most effective decisions for the organization. The board will be mixed in nature, which means it will contain clinicians with strengths in clinical knowledge, as well as community members with expertise in areas such as finance, legal, and IT. Next slide. You may recall from our application that the main objectives of the Perth Family Health Team are to run an unattached clinic. A weekly clinic will be held for those without a primary care provider, and this clinic will provide a link to a nurse practitioner and other healthcare services as needed. We will provide programming services for those who require care in regards to mental health. We will serve marginalized patients, And the Indigenous Care Navigator will provide support for those patients and families who self-identify as First Nations, Inuit, or Métis. Last but certainly not least, we will care for our aging population. Next slide. So how will the Perth Family Health Team enhance the opportunities for care coordination in our community? The Family Health Team will operate with a team-based approach where a variety of healthcare professionals will work together to address the various needs of patients. This collaboration allows for a holistic view of the patient's health and ensures that all aspects of their care are considered. By having multiple healthcare professionals within the same team, we can provide integrated care that addresses both the medical and non-medical needs of patients. This can include coordinating services such as mental health support, social services, and lifestyle interventions alongside medical treatment. We have a system in place for securely sharing patient information among team members, and this enables better communication and coordination of care plans. Lastly, we will emphasize patient-centered care where patients are actively involved in decision-making, which fosters better engagement and adherence to treatment plans, again leading to better health outcomes. Next slide. The Unattached Clinic and Indigenous Care Navigator. Those patients without a healthcare provider can register with Healthcare Connect. Healthcare Connect will be informed of unattached patient clinics, and our goal is to attach patients to a nurse practitioner through this clinic. The Indigenous Care Navigator will address the healthcare needs of Indigenous communities with cultural sensitivity. The Navigator will prioritize Indigenous perspective and traditional healing practices. They can perform home visits for Indigenous clients, assess their needs, attend appointments with them if they wish, and also advocate for Indigenous people within the healthcare settings in the community. Next slide. We're very fortunate to have received funding for mental health services, including services of a psychiatrist and addiction specialist. We are working towards creating a comprehensive and coordinated approach to mental health care, ensuring access to mental health and addiction services is easy for patients. We want to offer the right care by the right provider at the right time. Next slide. You will hear us speaking about building healthier communities, and this means that people working together to address what matters. This could involve reducing barriers to care, and we've been in contact with the table. Relieving loneliness, and again, PEP Seniors Therapeutic Center will also be partnering with us, and providing cognitive behavioral therapy to those patients who are involved in a chronic pain clinic. Community organizations will act as a bridge for us between the Family Health Team and the users of the program. Together we are stronger, and we embrace engagement and collaboration to provide the best care for the Perth area. Now, I'd like to offer an opportunity for anyone to ask any questions if they wish.
Go ahead, Councilor Gray.
Well, first of all, I think that your presentation was great. I think that moving to a family health team is certainly the route to go. I just wanted to ask, in terms of your governance, is your board of directors already set up and operating?
We're in the process of setting that up. We do have a board now, and we are filling out the membership. So
You do have an executive director?
Yes. Right here.
So you're not talking anymore. Okay.
PEP works, we work closely. So, yeah, which is a nice transition.
Yeah. You know, I just think it's a great program, and I was lucky when I lived in Mississippi Mills to be part of the Ottawa Valley Family Health Team, and I just saw how effective it was, and kudos to you guys for doing this. It's incredible. Good steps forward.
Mayor Brown.
This is absolutely fantastic. As some people who have sat in the waiting room for 8 to 9 hours, that will improve things so much. And one of the things that will help improve it is nurse practitioners on the family health team. We're just in the beginning stages of planning, but given population and so on, how many nurse practitioners do you think would be feasible?
Well, as part of our funding, the funding we get from the ministry, it's going to provide 5 new nurse practitioners spread throughout the clinics. And so we anticipate that that's going to allow us to roll, the back of the envelope. That's I think around 3,500 patients. It remains to be seen how this ends the patch, but the hope is somewhere in the 35 range. So I think it'll be helpful for the community and our surrounding area for sure.
Yes, I think that it would certainly alleviate the number of cases that needed to be treated by a physician. Triage, I mean, it's something that can be handled by a nurse practitioner, and it cuts down the load.
Well, we hope that it would make a difference, say, in our emergency departments a little bit and cut down on wait times there. How much of a wait time drop there's going to be because of this, we don't know. But if someone is able to receive more effective primary care, certainly in some of those cases, they won't end up in the emergency department because they get ahead of their conditions and things are taken care of before it reaches the point where they need to go to a hospital. And that's part of the whole of just building a more robust primary care system.
Councillor Bird.
Thank you, through the chair. I pick one thing, it doesn't mean that I'm not interested in everything else that's going on, but I understand it's a whole thing that you presented to us here. In relation to mental health, would whatever you set out, the model you set out, and the professionals that you have, would they take referrals from other agencies, or is it just people that come to them directly, or through your other clinics? There's an identified. Because I know that in this county for decades now, there's been a move to integrate referrals from emergency services and mental health.
So to answer that, I've already developed a working group and spoken with several other providers of mental health in the community. We've looked at what services they provide and what gaps they have identified, and what our purpose is then to fill those gaps. And to answer your question, some of those services will require a referral from a physician or perhaps another agency to say, this is not the right care for you, you need to step it up, or you're doing really well, we need to put you in a program where you can continue to be monitored. So there may be some ability to transition from one program to another, but then also it's important that people have the right care at the right time. So if they're ready to reach out and say, I'm really recognizing that I need help right now, if they're calling into the doctor's office, perhaps that receptionist can say, do you want to speak to this allied healthcare provider as opposed to your family physician? But I mean, honestly, it's not all been completely set up yet, but that is the hope, that we can provide care at the right time for people when they're reaching out.
And if I may also say, we, Suzanne mentioned, we've got both physicians that are part of this funding range, but one being a psychiatrist and one being an addictions medicine physician. And that's open to the entire community, of course, if it takes a physician referral, that can happen, or a practitioner can refer. So there's the opportunities, I think, for increased mental health care in our community are only going to grow with this initiative. So, and of course, we want to be efficient and we want to work well with the other players just to make sure that we're using the resources properly. Thank you.
Any further questions? I just had one. Is there any chance of having the nurse practitioners work out of above the normal office hours of before, like later on in the evenings? to sort of catch that overflow, that a lot of people wait until after normal working hours to have an issue. I don't want to put you on the spot, just I'm sure someone may come up with that idea or that question for us. Out of the standard working hours.
I suppose there's always a chance of things like that happening. It's not in our immediate plan, but definitely it's something that we can definitely look at.
Sure, okay, thanks. Any further questions? No, okay, thanks, Dr. Kniff, thanks, Sam, for coming in. Nice seeing both right there. And sorry, Councilor Brown, you have a motion?
Hereby we seek for information, the delegation from Buchanan Tool, interim executive director, Earth Health, Family Health Team, as presented at the committee of the whole meeting on June 4, 2024.
Discussion on the motion? All in favor of the motion? Carried unanimously. Next presentation is Rachel Burns, Executive Director for RNJ Youth Services. Welcome, Rachel. Can you speak in the microphone, please, for the people at home? That's perfect.
So as I mentioned, my name is Rachel Burns, and I'm the Executive Director of RNJ Youth Services. We have a slideshow, but I'm going to probably differ from that a little bit, but for the best I can. But for those of you who do not know what RNJ Youth Services is, that's the exact reason that I'm here completing these delegations. And I've been doing that across the counties, the 3 counties that we serve, which are Lamar, Queens, and Grenville, to increase awareness about the programs and services that are offered by RNJ. I took over as the ED about just a little over a year ago, and a lot of what we were hearing through community consultations and feedback is that nobody knows that RNJ exists and what it is that we do. So this is the first step in trying to deal with that, is to make sure that people do know who we are, what we do, and do. So RNJ Youth Services actually originated in the town of Smith Falls in 1987. So we've been around for a very long time. And so many of you are probably very familiar with Lamar County Community Justice. So Lamar County Community Justice, just to explain the difference in the 2 programs, it is confusing. They work with, they do the restorative justice side of things. We handle all the rest. We do a lot of the early interventions, so we're working with young people before they are criminally charged, trying to divert them from that. And we start doing that with young folks as young as 8, so 8 to 17, to try to push them down a different path and not have to access the services of things like restorative justice. And then on the flip side, we also work with those who have committed an offense where there's not a victim, like drug-related offenses, or sometimes there is a victim component, but the victim's not interested in participating in that process, and then we work with those. So that's the main difference between the 2. Lamar County Community Justice does the sort of piece, we kind of scoop up all the rest. So just 2 slides, yes. So some statistics for you guys here, just by region. So these are the stats for 2021 to 2023. So you'll see 2021 to 2023, we served, over the 2-year span, we served 46 youth that reside in Perth. Last fiscal year alone, so the 23-24 fiscal year, we supported 61 youth that reside in the town of Perth. So needless to say, our numbers for across the board are dramatically increasing. The last fiscal year alone, we served 1,700 youth across the 3 counties. Which is, if you just flip to the next couple slides again, sorry, you'll see that our highest number ever was just over 900. So again, last year we almost doubled that. So it's a growing trend for us. It's the referral numbers are increasing, and it's not getting any better this year. We're already sitting at about 350 youth served across the 3 counties, and our fiscal year just started first. So it's probably going to be higher, hopefully. It's not, but it's probably going to be higher at the end of this fiscal year. So some of the trends that we're seeing are increased caseloads, obviously, like I just mentioned. But not only are the caseloads increased, the complexities are increased, so the youth that we're serving. You know, when I started at RMJ 14 years ago, we dealt with a lot of youths that maybe committed petty thefts and some vandalisms and things like that. Now, we still do receive referrals for those types of kids, but we're getting so many more referrals for kids that, you know, it's increased family conflict, increased conflict at school. You know, they're threatening to cause harm to others, which is not something that we really had a lot of experience with. But historically, this just seems to be on the rise. Other really trending things, unfortunately, are internet-related crimes, so technology-based crimes, sending and receiving inappropriate photos, selling inappropriate photos online, using social media platforms to threaten or intimidate other folks. That stuff is really increasing to the point that we've worked with our local police partners, Lanark Peace and Assault Police, to create a presentation, an educational presentation to try again to be preventative and try to get out to the schools to educate the folks, the students on internet safety, to try to curb that, because the referral for those related crimes alone last year were up over 42%, which is pretty large on the grand scheme of things. The other thing that we're seeing a huge increase in is hate-related crimes. Hate crimes specifically, which is very unsettling, and we unfortunately don't have a lot of resources locally to combat that. We have a lot of really great groups of people that are trying, but not a lot of like educational programming to combat those things. So folks are being forced out of the community, like Ottawa, for example, access specific programming to those things. So we're working hard as an agency to try to bring these things to kids locally so that they don't have to travel. Our staff travel throughout the counties to meet the youth in their home communities. So that, you know, it's at least one decreased burden on families. They don't have to travel to Smith Falls, which is where our main office is, to meet with family or to meet with the caseworker, or to travel to Ottawa or Kingston and go to access those services. So yeah, I mean, just like I said earlier, we were really putting the push on trying to focus more on being a proactive agency rather than a reactive agency. Youth justice is very reactive. It's always been very reactive. But you know, we haven't received a funding increase from Youth Justice Ontario in 18 years. So I think unfortunately the writing's been on the wall over that we got to pivot a little bit if we wanted to do something. And we're aiming to pivot more towards those proactive, preventative, early intervention type programs. So, you know, some things that we're looking for from communities is general advocacy, awareness. We can always use volunteers in communities, so just that promotion of that. We use volunteers to facilitate our Lead Our Choices program, which I didn't like to talk about that, but it's we operate a drug and alcohol education awareness program for grades 7 and 8. It's pretty well the target. So we go into the schools over 10 weeks and we facilitate that, and we bring along community volunteers with us to help, you know, sit at the table with a kid, mentor a kid, help them through programming, answer questions they have, and stuff. So those are all things that communities can do to help them. And one of the biggest things is use of space, because we do travel to communities. We don't always have space in, like you had just mentioned, about the things being open 8 to 4. That's a barrier for a lot of kids and a lot of families. So having access to space after 4 o'clock is very beneficial. So those are just some awareness that can see. Watching the clock over there. Okay. Close enough version.
Councillor Gold.
Thank you, through the chair, Rachel. You know, you alluded to the fact that you know the need is expanding year after year, almost exponentially, and I get that, and we see that in society every time we turn on the news at night and so on.
And I think one of the most important things that you alluded to was to identify the need at an earlier age so that you can try to address the issues at an earlier age. And we all know that a lot of the preventative maintenance should be starting at home. It's not starting at home anymore because all the parents are also caught up in a world where we're all so stressed and so on and so forth. You mentioned also that you hadn't received any funding increases in over 18 years. What can we collaboratively as communities that are within your geographic reach do? What's the most important thing we can do to help you succeed in getting more funding and to support you in your efforts to achieve the goals we want to achieve?
Yeah, I mean, I think just general advocacy. Last year, I did complete a delegation at Roma to Minister Parsa with the support of the mayor from Frontenac Young, from Allentown. But I think like the more, this tri-county region can sort of band together to say like, we need support and we need support now. Youth Justice did, they did build what they call a task force to look at youth justice funding, but it's all folks who reside in the GTA and they do not understand what we deal with in rural Ontario at all. Yeah, and some of the suggestions, when I try to explain to Minister Bruce when I'm having a conversation with him that, one of our staff can start at Gananoque in the morning and end in Elmont. That's 2 hours worth of driving back and forth. It's 4 hours of a 7-hour day. You can't be with a lot of kids in 3 hours, and you can't just hand them a bus ticket and say, oh, come to our office, because that's not, and creating a task force of folks that only reside in a metropolitan area like that. How do you do that? That doesn't make any sense. So yeah, I think I'm gonna request another delegation next year, because we did not get another funding increase this year, so I'm gonna keep trying. So I mean, like letters of support, advocacy, when we do those kinds of things, I think is the best, is the only thing we can ask for. Because.
Thank you, certainly got my support.
Councillor Bird.
Thank you through the chair. Rachel, thanks for the organisation. I'm fully aware of it. I used to spend a lot of my time in my previous job at the youth corps. I'm just surprised by the volume increase and partially surprised by the nature of what we're now dealing with and the way that the organisation is trying to morph into something that is preventative and not the model that I was more familiar with years ago, working alongside it. I noticed on one of the parts of the presentation that you're struggling to get volunteers as well. And I wish I could come up with an answer for that. But as Councillor also alluded, I think whatever we can do, even if it's a letter of support, I think we'll probably see a motion come off from at least one of us. But thank you for all the work you're doing. It is very, very done.
Councillor McCray.
Through the chair, how many staff do you have to cover that huge area of Leonard, Lacey, and Redhill? 5. And yeah. And the other question I have is, how are you funded?
So our primary source of funding comes from MCCSF, the Mission of Children Community Social Services. We do get a small amount of funding also from the Ministry of the Attorney General. We offer a partnership program with Leonard Beats and Federal Elections and Mental Health. That's our Rebound Trusts program. We go to schools. It's Money from United Way, we use the Grenville. We do fundraising, write grants, all of those things, but it's not unfortunately enough to keep up with the rising, just general increases of the cost of living. The cost of all of our stuff rises too, just rent, insurance, benefits, all those things, just like everybody else's, right? And our staff are well over capacity in terms of trying to support all of those 1,700 youth across the 3 counties. 25 of them to do it.
It's a big area to cover.
Councillor Brown.
Mayor.
Oh,
So the services you offer are mainly for mental health.
No, they're primarily for youth who are either justice involved or at risk of becoming involved with the justice system. So I shouldn't say, a lot of the youth do struggle with mental health issues, a lot of the youth struggle with addictions issues, development, homelessness, food security, all of that, all of those.
So, do you, link with organizations like the ACT and Cornerstone, and
Open doors, addictions and alcohol, all of those.
anyone else? Have you made a presentation to the county levels? Leonard County, how come?
Just starting to do this, like it's just been something, we just, our strategic plan is up for renewal this year, so we started back in January having those community conversations. And that's where we started to learn that people don't even know that we're here, right?
Yeah.
So we're not somewhere that places look at for donations or for granting because, and to be honest, a lot of the feedback that we get is, well, the minister should be that they should, but they don't, and if you could tell them to, that would be great, you know, but, and yeah, I think it's a whole, this increase in everything, it's a whole new world for us, and we're just trying to navigate it, and we're just starting, I think it's the short answer, so.
Yeah, I think if you attend a county council both here in Leeds and Grenville, is then you're gonna capture a lot more municipalities at one go, and then the letters of support, like in Leonard County, we get 9 letters right off the bat. Instead of I'm just trying to save you some time about letting you know, but I'd welcome you as a county council to come, because I didn't know about you until tonight. So it would help. Any other questions? Councilor Bird.
Thank you, through the chair. It's not so much a question of delegation, but procedurally. We regularly see letters from other municipalities encouraging support. And is there merit, or what would be involved in us keeping that process off this municipality?
Through the chair, so if the committee wanted to make a recommendation to support and circulate to municipalities within the county, council could do that.
Yeah. If that requires a motion at some point during this proceedings, that would be definitely.
Okay, so we do have one motion for the presentation, Councilor Bold, if you'd like to go ahead with that one.
Yes, Deputy Mayor, moved by myself as recommended by the committee, the whole be resolved, the council of the town of Perth hereby receive it for information. The delegation from Rachel Burns, Executive Director, RNJ Youth Services, as presented to the committee, the whole meeting of June 4th, 2024.
Discussion on the motion? All in favor of the motion? Did you have another motion you'd like to make?
Yes, through the chair, if I may, that the staff look at the recommend a wording creation of a letter of support and request for extra funding for the ministries involved in relation to specifically in relation to Reverend Norman Johnson Youth Services.
Okay, discussion on the motion? All in favor of the motion? Carried, absolutely. Okay, thank you very much for your presentation. Okay, our next delegation is Dr. Todd and Selena Tuttle from the Leonard Basic Income. See you again. And again, if you wouldn't mind speaking directly into the microphone.
Okay, how's that?
That's perfect.
Right. So thank you for the opportunity to present on behalf of the Leonard Basic Income Network. I'm Selena. I grew up in Lanark County and I've lived in Perth for the last 3 years. I have degrees in social work and in psychology, and I've worked in the health fields for many years, more than 20. So through my own lived experience and through my work experience, my professional life, I am familiar with the challenges faced by those of us who live with financial and income precarity and or in poverty. I'm here tonight with my colleague and fellow LBIN volunteer, Tom. And we are two of 19 volunteers working through the steering committee, the outreach and the political advocacy committee and LBIN. And we are also part of a larger growing coalition of, I think it's 153 other members and volunteers throughout Lanark County, many of whom reside in Perth and some of whom are here tonight. So before we jump into the presentation, I'll just give a definition of what basic income is. It's an unconditional cash transfer from governments to individuals that should enable everyone to meet their basic human needs. To participate in social life and society, and to live with dignity. So it's an income floor to reduce the risk of people slipping into poverty by unexpected events in their lives, life transitions through the course of living, and challenges that we face in these very trying times. Next slide, please. So this is the income tested basic income. It's a model that is supported by a majority of advocates for basic income in Canada. And as you can see on the left, so in the absence of any other source of income, an individual would receive the full amount of basic income. However, as other sources of income increase, the basic income decreases and is eventually phased out. Next slide, please. I'm just going to say next instead of next slide, please. Okay, so basic income programs do already exist in Canada. For example, the Canada Child Benefit is available to families and caregivers of children who are children and youth 17 years and younger. And then we have the guaranteed income supplement for seniors 65 and over. So these are long established working basic income programs that where money is distributed to eligible people regularly and with their requirement for work. And absent other income, these sources of funds will help to meet basic needs. So we propose something similar for individuals between the ages of 18 and 64. A basic income guarantee to help eliminate or reduce the risk of people sliding into poverty because of the precarity of work situations and difficult life experiences and challenges. Next, please. So the first benefit of basic income is financial stability and flexibility, because almost everyone is vulnerable. We are, I'm sure most people in this room have experienced or know someone who's experienced one or more of these situations. And these are not uncommon events, but they make our lives unpredictable. And that unpredictability has tremendous wear on individuals, on families, on households, on our communities, and on society as a whole.
This precarious income, it's not going to be restricted to any particular class as it exists today. There are changes happening in the workforce across the developed world that are going to affect job creation and job persistence across all workforces, with the introduction of AI, for example, which is affecting people in the high income brackets as well. So it's a real thing. I'm of the opinion that it's only going to get worse with the development of these new technologies. And then of course we have the example of the pandemic and the use of the CERB, which was a form of basic income helping through.
Next slide, please. Next. The second benefit of basic income is improved physical and mental health and a reduced demand on the public health system. So there's a powerful correlation between income and health outcomes. So for at each rung of the income ladder, Canadians have less sickness, they have longer life expectancies, and they have improved health overall. And that is from the Government of Canada's Social Determinants of Health and Health Inequalities website. Earlier this year, the Hamilton Spectator reported on the increasing health disparities between have and have not neighborhoods in Hamilton. The Mincome Manitoba Basic Income Project from the 70s, that data was analyzed recently, and researchers reported a decrease in hospital visits related to mental health issues, lower rates of domestic violence, lower rates of work-related injuries, farm and motor vehicle accidents. And the some of the data from Ontario's basic income pilot, which was shut down when the Ford government came in, they received some of the data and analyzed it and found that again, there were improved mental and physical health outcomes and for participants, but also for people in the houses of participants. And they again reduced the medical system. And I say they got part of the data because the province hasn't released all of the data. So the researchers worked with that. And they were from McMaster and Ryerson universities. Next. So our own health unit has acknowledged the linkages between income and poor health outcomes. So lower income households report poor physical and mental health. They have a weak sense of community belonging. They do not have regular access to a doctor. They do not have dental insurance. They are much more likely to experience food insecurity and more likely to have a diagnosis of one or more disorders, such as anxiety, asthma, diabetes, high blood pressure, heart disease, and diabetes and immune disorder. They are more likely to smoke, and they are more likely to be physically inactive. Next. So the third benefit of basic income, it stimulates local economies. So people have more money to spend, demand for goods and services increases. Existing businesses are more likely to prosper, new ventures are more likely to open, and the availability of jobs are more likely to increase. Basic income moves very quickly through the economy. Next. So this graphic is, it draws on the Canadian Centre for Economic Analysis report, that's CANCEA. They did an analysis of the benefits of the Canada Child Benefits on the Canadian economy. And they found that for every dollar dispersed through the program, $1.97 was contributed to the GDP. Meaning that the economic activity generated by the program is almost more than double than the benefits dispersed. Next. So support for basic income is growing. It's been around for a long time, but particularly since the pandemic and a lot of the changes that reached upon our societies. So we have long existing, well-established basic income programs. 6 of 10 Canadians have indicated that they would support a basic income program for low-income households. We have bills before Parliament right now, one in the House and one in the Senate. Both are asking for a national framework for the basic income. There are existing basic income programs in Newfoundland and Labrador and in Quebec. There's a very credible proposal for a basic income project in PEI for working age adults. There is all party support for that project. And this year, the federal government indicated it's willing to explore the project with PEI. And of course, there are many municipal resolutions in support of the concept of the basic income. Our chair, the LBIN chair, and the Reeve of Tea Valley Township, who is, oh my gosh, Rob Rayner, who many of you know. So Rob is making a presentation tonight to that committee of the whole. And I'm hopeful that with this presentation and that presentation, we will have 2 more councils supporting the concept of basic income. Next. And this is our ask of the Perth Town Council, that the town express support for the concept of the basic income and call upon the federal, provincial, and territorial governments to collaborate on the design, introduction, implementation, and ongoing evaluation of a national basic income guarantee for working age adults. So all that to say thank you very much. Thank you very much for the opportunity to present.
Okay, Councillor Gold.
Thank you, Mr. Chair. So, my question, for you, Selena, is, through your whole presentation, and thank you for that. There's never been any mention as to what the annualized amount of income, you feel is necessary for this whole, perform of the work. What is the dollar amount per year, or do you even have a dollar amount yet, that is, been determined to say, this is the level I need to be at in order to achieve the goals of your presentation?
I do not have that information, but greater minds than mine have worked on it for a very long time. Oh, I'm sorry. So other people have been working on this for a long time. I brought some reports for people to read. We're looking for detailed information, and the amounts vary depending on the projects. And I think that it's important to recognize that we are requesting too that governments look into this. There are a lot of anti-poverty organizations and social policy researchers and people of the general public, health advocates, who are and politicians, conservative, NDP, green across the political spectrum, who are looking into this. I'm sorry, I do not have that information to provide to you tonight.
If I could just add, I believe that the Prince Edward Island proposal has had one of the best economic analysis that I'm aware of in our country. That counts. My recollection, don't quote me, but I believe they were talking in the range from $7,000 to $30,000. But that is in their proposal. How that will finally cascade out is going to depend on time. Thank you.
Councillor Waterfield.
Through you, Chair, I want to thank you for a very informative presentation. I'm a strong supporter of basic income. I applaud and I support your efforts.
Okay, Mayor Brown.
Yes, I know it's been found that within the justice system, if there's a community justice program that in effect brings societal costs down because kid doesn't end up going to jail, and remedial efforts. Have you found a similar thing with the basic income?
I cannot speak to that. I am not aware of that particular kind of research, but certainly in other research I have done, the stress of financial precarity, it increases family violence, it increases stress in families.
I do have personal experience of someone who has committed suicide because of his business failed. But.
Yeah, not a suicide note, but in terms of reduction of costs, the Stanford Basic Income Lab in Stanford University of Fabulous reputation, as you know, has recently, I think it was 2021, their review came out and showed that not only was poverty alleviated to a considerable, but there was the greater enrollment in educational processes and a decrease in the number of visits to emergency departments and health and that type of thing. But it's not well quantified, that's the problem. And in their review, they looked at studies that were done across the world. So a lot of their data isn't just in North America, it's also in third world countries. And that's why it's so important that our government develop a framework and a discussion. I don't think anybody has got it figured out in their head right now exactly how this is going to roll out if it ever comes to fruition. But there's enough data out there to suggest how important it is, and that we need to at least begin to discuss how the framework would roll out and where the savings can be made if indeed they're there.
Can I share with you a quick quote from the Stanford Basic Income Lab, their report? The evidence from diverse interventions in low, middle, and high income contexts indicates minimal impact on aggregate measures of labor market participation, with some studies reporting an increase in work participation. When reductions do occur, time is channeled into other valueless activities, such as caregiving. And that's from their 2021 report, a copy of which I can get.
Sure, final comment, we're going to turn the floor to Councilor Craig.
My parents raised their three oldest children during the Great Depression, and I could tell you stories about what it was like, but it was said that it didn't really bother the kids that much because everybody was the same. But you've got, a far different situation here where people with a great deal of money and people with virtually none, and that wouldn't be expressed.
Okay, Councilor Craig,
To you, Chair.
one final comment, Councilor Smith.
I just want to thank you for your next presentation. I fully support the work you're doing, and I also support basic income.
I'll just let Councilor Burns have some comment because I'll turn the floor to Councilor Craig.
Thank you, through the chair. I was going to ask a number of questions about the mechanics of this and how it would operate, but I brought myself back to what you're actually addressing with this. It's quite clear from what you're saying, it's the concept and principle. I was going to ask questions about, is it residents, is it citizens, is it nationally, as you said, or is it provincially, as the examples have been given? But I'll wait. It's concepts that I'm happy to follow. And I support that.
I'm happy to try and answer.
No, it's all right. We can speak for and support this.
Okay, so I'll end that portion of questions for the delegation. I'm going to turn the floor over to Councilor Craig.
Thank you, Chair. So I have two questions. First of all, if you could talk a little bit about Ontario Works and Ontario Disability Support Program and how this program will enhance those pots of money.
Sure, enhances the rate. Ontario Works, for example, if you're looking for resources to support basic income, Ontario Works would cover this. Quite frankly, as with several other programs. In terms of the disability benefits, that would probably enhance them because the disability benefits that are currently being paid are so far below any level that people with disabilities can support themselves on. It would probably enhance their ability to participate in society more fully. I haven't read anything, as you have stated, where we've talked about any change to the disability programs as they currently exist, but.
Well, they're deeply insufficient, we know that,
Exactly.
and they don't meet the basic needs. So that's the first one.
In some, a basic income policy would, of course, it would interact with, the mayor programs. And some of which would be, streamlined, as they're doing in PBR, or sorry, in, Newfoundland and Labrador. And others would disappear, and others would be expanded or enhanced. But that is why we're looking, for, an examination of the basic income by governments. Sorry, go ahead.
And my second question is, well, first of all, I'm totally in support of basic income concept. And in fact, I will be bringing forward a motion here shortly. But I know there will be people in the community who will say, because I've heard this, and they say, you know, if we gave a basic income, then some of these folks will not have an incentive to go out and get a job. So how do you, what's your thought on that?
There is no evidence that I'm aware of, proving that a basic income is a disincentive to work. A lot of the research shows that people tended to work more because they were able to improve their financial status by working and not having clawbacks. Like this is a guaranteed basic income. And the research suggests that where people did leave work, it was to care for others, to raise their children, to pursue an education, or they left a low-paying job and moved on to a better job with better prospects, better pay, and chance to move ahead.
So in other words, it provided them with more options.
Yes, very succinct.
So can I bring forward?
You sure certainly can.
Okay. As recommended by the Committee of the Whole, be it resolved that the Council of the Town of Perth hereby, number one, receive for information the delegation from Dr. Tom Todd and Selena Tuttle, Lanark Basic Income Network, as presented at the Committee of the Whole meeting on June 4th, 2024. Number two, adds its municipal vote to the call for the basic income guarantee for work-age adults in Canada, which would help to combat low income and economic vulnerability within our community. Number three, calls upon the federal, provincial, and territorial government to collaborate on the design, introduction, implementation, and ongoing evaluation of the National Basic Income Guarantee Program for working-age adults. And number four, directs the Council's support and request for action be forwarded to the Prime Minister, the Premier of Ontario, the local MP and MPP, applicable federal and provincial ministers, the Federation of Canadian Municipalities, FCN, the Associate of Municipalities of Ontario, AMO, the Rural Ontario Municipal Association, ROMA, and Eastern Ontario Wardens Caucus, EOWC, and Lanark County municipalities.
Discussion on the motion. All in favor of the motion? Carried unanimously. Thank you very much for your presentation.
Thanks very much.
So number 7 is correspondence, McDonald's Restaurants, Plymouth, Fayetteville, Smith Falls, and Councillor Smith, would you move the motion of attaching the correspondence?
By myself, that's recommended by the Committee of the Whole, be it resolved that the Council of Town of Perth receive for information the letter from McDonald's Restaurants, Perth, Kentville, Smith Falls, McHappy Day, May 2024. Results. Councillor, myself, dated May 10, 2024.
Discussion on the motion. All in favor of the motion? Carried unanimously.
Can I just say?
Certainly can.
Reason I wanted that put on the agenda is I found it amazing that 4 Tim Carter restaurants, Perth, Smith Falls, Carlton Place, and Kempville, raised over $75,000 on one day for Ronald McDonald House and 2 family rooms at Cheel, inside Cheel. I thought it was pretty amazing.
Sure is. Okay, 7.2, request action, May 23rd, 2024, Leonard County Inclusion, Diversity, Equity, and Access Working Group participants. Mayor Brown, your motion.
I do. It resolved that the committee of the whole, the town of Perth, provide direction regarding the appointment of 1 representative to the IDEA working group for the following office, recognizing that mayor or deputy mayor are appointed as county council representatives. Perth would not have any additional representation. So first option, members of council, any council member may submit an expression of interest to the clerk by June 21, 2024. Number 2, member of the public issue a notice seeking expressions of interest from members of the public by June 21, 2024. Or number 3, member of town staff. Any staff member may submit an expression of interest to the clerk by June 21, 2024. I'd like to make an amendment to that and just use number 3, and Director McNally would like to be on that committee.
Okay, so discussion on the motion. So it's put forth, there was 3 options, and let's move to the 3rd option, that staff member Director McNally be appointed, because we know she is quite interested in. I'll open the floor for discussion because there was 2 other options there. Any discussion? Councilor McRae.
I think that it's really important that when we talk about members of the public, that there is representation from various groups when it comes to diversity, equity, accessibility, and inclusion. That those are, high considerations, because we need to have those type of people involved in the decision making in regards to being more accessible, inclusive, diversity, and equity. And I say that because when I used to sit on the Upper Canada School Board with Special Advisory Committee, which had to do with children and youth and that type of thing, we had a member from a particular organization sit on that committee who had a disability, and he brought forth excellent ideas that somebody who doesn't have a disability might not even be aware of. So I just wanted to bring that to the forefront.
Okay, any other discussion on the motion? Okay. So I guess I'm gonna ahead of myself, so we're just gonna vote on the motions presented by Councilor Grant first off, and 3 options, and then we'll pick my other options in the next motion. So the motion on the floor is just as you see it on the big board. We're not appointing anybody at the current time, it's just we're accepting those are the 3 options. And then we can make a second motion after that. So any discussion on the motion on the floor from Mayor Brown? Any further? All in favor? Carried. And Mayor Brown, do you have a motion?
Yes, the amendment that I am proposing is that.
So you're moving the 3rd one as a motion, not an amendment.
Okay, so using the first paragraph and then the last paragraph. Be it resolved that the committee of the whole first provide direction regarding an appointment of 1 representative to the Latter County Inclusion, Diversity, Equity, and Accessibility IDEA working group in following economic following options. recognizing that as per the idea working group, terms of reference, if either representative Earth would not have any additional representation, and then going on. Another thing, member from town staff, I would suggest that the Director of Community Services be appointed to the IDEA committee.
Okay, so that's the motion on the floor, and just for council's understanding, neither myself or the mayor are sitting on this committee from the council perspective, so that still allows us to appoint someone from town staff, so discussion on the motion about appointing town staff member Director McGowan.
Through you, Chair, just regarding Councilman McCray's comment that the terms of reference do allow 4 or 5 members appointed from various community-based organizations that support the area of the IDEA committee, so.
So they will be represented.
For the terms of reference.
Okay, thank you.
Any further discussion? Councilor McCray.
And what I'm hearing you say is then that our representative from our town staff we're putting forward as Kathy McNally.
We are.
Correct? And does that still mean there will be a member of council?
No.
No, she will be our representative.
Yes. Okay, any further discussion? All in favor? Carried unanimously. Thank you. On to staff reports, grants to others, Brian Burns and Kathy. Yeah, looks like Brian's gonna do this one.
Okay, I attempted to declare a conflict of interest at the beginning of the meeting. I have a hand up.
Okay.
And the reason I'm declaring a conflict of interest is because I'm volunteer and I fundraise for the table.
Okay, thank you.
I'm also on the board of directors for the Chamber of Commerce.
Okay, perfect. Okay, so Councilor Byrne, I'm gonna get you to move the motion first to get discussion on the floor.
Thank you, Chair. Moved by myself as recommended by the committee of the whole, be it resolved that the council of the town of Perth approve process for establishing the 2025 grants to others budget as presented in report 2024-CAL-8.1.
Does any member of council have a question for staff regarding their report? Or I open up to any other questions? Councilor Bolton.
Based on what I see here, the only thing that I would recommend is a friendly amendment to the committee or to the staff when they're bringing this report forward, and that is to compare the amount of money either in a total dollar amount or as a percentage of revenues or however they want to look at it, compared with all the other communities around us. So that they're comparing apples to apples in terms of dollars spent. I believe in saying that, I believe we're one of the highest. We put out more than County of Lanark. So I'd like that information to be gleaned through the recommendation.
Okay, so I'll take that as an amendment to the motion on the floor.
Yes.
Okay. Councilor Byrd.
Thank you through the chair. Would I be right in thinking it through my read of this that there's no recommendation that you outline a number of options? Would that be correct?
That would be correct.
And secondly, that this is an issue that's come up repeatedly at budget discussions over the years. No steps have been taken. Would that be fair to say that?
That's also correct.
And the question then is that I suggest that we receive this more for information and for consideration of each member as we move into a budget process. That we don't discuss the ins and outs of it now.
Yeah, we're not going to. We do have an amendment on the floor from Councilor Bolton. You'd like more information. Is there any comments you two would like to make about? I know you have several ideas about process, but does that help you at all moving forward?
So, through the chair, and Kathy's the subject matter expert on this, but she actually is in charge of all the processes for giving agreements. And I'm just here as the primary budget officer in this particular case. So council had asked for this particular topic to come to council well before the budget process, so it could be considered and in its entirety with a little more clarity, I guess, as well. We did actually consider the amendment and rejected the idea that everybody accounts for them differently. So we account for them all in one pot, and some places account for, like, they'll give out a contribution, like the mayor's discretionary account might give out support for the various things, or somebody else's departmental budget might come out. And if we actually tried to compare them, we didn't think we would be all that terribly successful at actually drilling down where it was a pure comparison. So this is presented really as a, the last 2 years, I basically presented that we should try and reduce the total amount of the grants to others, because it's currently taking up about 2.5% of our tax revenue. Now, both those years, council considered it, rejected it, pretty much went with the same budget again. So this one has introduced the concepts of what might happen. If you have any specific examples, I'm pretty sure Kathy's going to be the one that's going to be answering those examples, but we could say, for instance, that we started at the 2.5%, and then we had an orderly decline down. Equally council could say if thought 2.5% was too low, you can have an orderly increase up. I think council should consider the concepts that once an organization gets a grant, there's probably a limited lifespan to that. It's probably not intended to finance that organization in perpetuity. So we could adopt an orderly downward pattern in terms of granting to individual organizations. And that would, of course, if we did that, if the grant for individual organizations decline exceeded the decline in the overall envelope, that would obviously free up money which could be reallocated to other organizations, at which point in time, even though it's a little time consuming, opening it up for those other organizations to apply every year is certainly an option. And we're sort of looking for some meaning as to, I think, what council would like to do with this one, because I don't want to just come back and go here and then have everybody reject it as opposed to gathering some feedback.
Councilor Bolt, sorry.
So, I get it, when you say, we had a very, very, lengthy discussion in our last, budget deliberation, and, we all were anxious to talk about reducing it overall, and then when we started to try to pare it down, as you alluded to a moment ago, there were certain funds every year that were being allocated to bylaw, as opposed to just the goodness of our heart. So in answer to your concern about that with my friendly amendment, what would be wrong with saying, okay, let's take another look at this and say, let's take the stuff that's governed by bylaw, because we're obligated to it anyway by bylaw, and set it aside, and then take a look at the rest, and then based on the rest and the accumulated amount between the two of them, what can we afford as a council going forward? I like your idea of saying this is not in perpetuity, let's move this thing. Because it seems to me that all the time on council, city groups are getting the same amount more every year for over a decade. And I think it's high time that we took a look at it. So kind of a two-pronged approach here. Let's set aside what obligated to by bylaw, can't change the bylaw, then we have to live with it. And then let's look at the rest and go from there.
Mayor Brown.
Thank you. With all due respect, Councilor Bolt, comparing what it's like in other municipalities, I'm not sure that that's a valid comparison. For example, a road superintendent or whatever, you could compare Perth to Tay Valley, and though their population is from the North Elmsley, sorry, their population is approximately the same as ours. Perhaps for whatever reason, their levy is higher. So having said it, in regard to who gets a community grant, one of them is the BIA, that's labeled as a community grant, and that's $105,000. Well, if you don't label community grants, then that's saves you a lot of money.
Other members of council, Councilor Waterfield.
Reading through the various options, taking in mind Councilor Gold's comment about those grants that are given because of bylaws, putting that aside, and it probably merits looking at, is there any way of changing some of those bylaws? I think we need to kind of peel the onion a bit more on that. I would kind of lean toward a combination of point number one and the last point. Limit the grant to whether it's 2.5% of property tax revenue, reducing to 2% over a 5-year period. So we're looking at gradually reducing it, not reducing overnight, but also looking at those organizations that are currently getting funding and having a mechanism in place whereby they cannot reapply so that we're able to then fund some other worthwhile organizations. So I think a gradual reduction of funding over a period of time, and then putting in combination then an opportunity for a mechanism for other organizations to apply, I think that would be due diligence and something thematically that I would support.
Councilor Bird.
Thank you, through the chair. I think Councillor Woodfield's hit it on the head that I believe the best mechanism is, as he's just described, and as you, or one of the suggestions that you made. Would I be right in thinking that it just, the amount, wherever it was established, the actual financial amount, sum that was put aside for grants to others, was never, it just happens to be close to 2.5%. It was never set at that. Would we be required to set it at that as part of our budget process in order to set that mechanism in place of reducing it?
Through the chair, you're correct, it was never set at 2.5%. I think it would provide a more orderly transition for this council and future councils if you did set a benchmark and agree to it.
Thank you.
Okay, Councilor Bolt.
I just final word on this. I mean, everybody knows how I've felt about this for 10 years and will change my stance. I mean, I understand and agree that there are groups that need support, but we all as a council have agreed many times over that we can only support so much financially. If we're going to achieve our financial goals going forward, we have to look at the big picture and whether we're funding a certain amount for whether it be the BIA or anybody else by bylaw or otherwise. The bottom line is the total number of dollars that we're expending. I like the idea of setting a benchmark amount. Whether I agree with 2.5% tonight or not is beyond me. But I think that does set a better benchmark, as we put it, and a way for us to move forward on this.
Okay, so you have an amendment on the floor to ask for additional information from other municipalities. Got that? Okay.
Yeah, so we have to vote on that.
No, can you withdraw that just for the current time for me?
Yes, we have.
Okay, so I'm over here on this side of the floor. You guys want to give them direction, because right now they have no direction. They don't have any options.
If I may speak to claiming motion, through the chair. That was my understanding of reading this motion, is that they would then give the direction. The motion is approving the process. So at some point today, we have to approve the process.
So that's what I asked to do.
Yeah.
So from your side of the room, though, you both made comments about what you think we should do, so I'm looking for some direction for staff.
I agree.
Okay. All right, so the clerk is telling me we can move your motion, okay, and vote on it. And then after that, we can make our process, actually select a process. So the motion on the floor is as read by you. Any further discussions on that? All in favor? Carried. And now you want us to decide on a process moving forward.
I would make a motion that staff be given direction that we establish an actual 2.5% in relation to the grants to others, and follow the mechanism as suggested in the format of reduction year by year.
Yeah, that's what I don't know which is. So which one are you picking, Councilor Bird? Can you move it up a bit?
So my understanding was that the current amount in the budget represents approximately 2.5%, is that correct?
To the chair, 2.5% is approximately where it's at now, and the suggestion in the report was that drops by 0.1% every year for the next 5 years until we get down to 2% of total tax revenue, which is where the remaining thereafter.
That needs to be the full version that we have. Yeah. Yes. Actually, it goes to the points. As the wording of the motion, that we limit miscellaneous GTO to 2.5% of property tax revenue, reducing it to 2% over a 5-year basis. And also that included that any organization currently receiving GTO funding will not be eligible to reapply for 5 years if they have already in a 5-year long grant agreement. Sorry, correction. If they are already in a 5-year long grant agreement with the town.
Discussion.
Chair, I'd like a clarification of 2 points. I didn't think we were voting on an actual mechanism tonight. I didn't think we were paying it 2.5%. I think it's up to the two staff to make a recommendation when they come back with a final recommendation for us to vote on, number one. And number two, define 2.5% of GTO for 2.5%. Is it 2.5% of the annual budget as approved, or is it like, because 2.5% of a budget of $17 million is one of it. We have all of a sudden our budget jumps up to $19 million. We're going up instead of down. So I'm kind of confused.
Through the chair, the suggestion was on total taxation revenue, which is currently sitting around 9 million approximately. We've maxed that at 2.5%. But you're quite correct, if the tax revenue goes up, even if the relative rate goes down, the actual dollar value might be.
So where we are is that we voted to let them have a process, and now one of the members of the council is moving forward what their idea of the process should be. That's why we're at the, that's what the motion on the floor is. So that still has to come back to the staff report to tell us what the outcomes is and what the impact on all these groups is going to be. Correct? That's your understanding from the staff point of view?
So they're not pegging it at 2.5% tonight, because Councilor Bird's motion is suggesting it's pegged. I'd rather see some more fluidity there and more direct.
So that's what they're looking for. And he's offering a suggestion.
I support direction and a mechanism. I just don't want to vote on 2.5% tonight. I'm not going to do that.
If I may, I thought that the motion was more of a direction to start to represent something of how that mechanism would work, what it would look like in dollar amounts.
Yeah.
And then we vote.
Yeah, that's what he's doing.
Okay.
He's just giving them a start. He's giving them a starting point, at least to start with something.
All right. That.
Right? That's your understanding?
The chair, we could also just, if council wants to give staff direction to come with 3 options that are looking at some of the options provided tonight, we can then give council a more fulsome overview of what the different options could look like, if that would help.
Yeah.
Okay, so you're okay with that, so now we're gonna get, allow staff to come back with 3 options to reduce the grants to others. So, yeah, withdraw your first motion. Okay,
Yes.
and your second motion is to allow them to come back with 3 options to reduce the grants to others. Okay,
After it's been said that the 2.5, so I'm worried about that thing. So what would it look like?
that can be one of the options.
Yes.
Okay, discussion on that motion on the floor, Mayor Brown.
I think this is premature. I don't feel as if I have enough information to vote at this point. I want to have an opportunity to talk to either of the directors before I will on this.
Okay, well, then my understanding of the motion is they're coming back with different options for you to discuss with them, correct? Any further discussion on the floor?
Staff is being directed to bring back 3 options to reduce the grants to others.
Yes. And one of the ones that you wanted was the 2 others. Okay, does that seem okay?
Sorry, through the chair, it's just to review the process for grants to others, as opposed to the word reduce. Is that fair? Or how does this one?
No, the wording was 2.5%. Correct. Of the mover. So that's one of your options. I guess to figure out.
Yes, what I'm looking for is similar to when you show us budget options for increasing that, what that would look like in actual dollar amounts. And I think that would help everybody.
There's not. Okay, any further discussion on the motion? All in favor of the motion? It's carried. All opposed? No. Councilor McRae is declared, and Councilor Mayor Brown is against it. All right. Property tax collection policy.
Trying to read it.
Councilor Bertie.
Moved by myself, as recommended by the committee of the whole, be it resolved that the council of Tenantburg passed bylaw number 51XX, being a bylaw to adopt property tax collection policy as presented in report 2024-account-8.2.
Discussion on the motion. Anybody have any questions? Councilor McRae.
So from what through your chair, what I read was we're going to go from a 3-year plan to a 2-year plan. And correct me if I'm right or wrong, according to recommendations in the municipal act. Is that correct? Okay, and what are other municipalities surrounding us doing? Are they following the 2-year plan?
Through the chair, all the other municipalities are actually following the municipal act, which says 2 years. We're one of the only municipalities in our county that's doing 3 years.
Okay, and it also mentioned 33. It's going to come into effect January the 1st, 2025, and there were 33 other properties that could have been, did I read that correctly?
Yeah, as of person through the chair, as of January 1st, there were 33 properties, however, given there were 33 properties, but they were not given proper notice as we would normally give throughout the year, so therefore if they would have given the proper notice, then there probably would not have been 33 properties. As of today, the exact same report written, there's actually only 17 properties.
Okay, so what are we doing to inform them?
Send out notice over the next 6 months, allow them to come to pre-authorized payment plans or any kind of plan to be able to get them caught up in the taxes.
Thank you.
Councilor Bolt.
I just wanted clarification on this, and I just read it briefly, and I get the whole thing about, being in line with everybody else over 2 years. The one message that I don't want to be sending out to taxpayers in the town of Perth is that we're a bunch of owners and we're out here to, you don't pay your taxes, we're gonna throw you on your house and we're gonna sell it for taxes. I mean, and I'm not suggesting doing, I just don't want that to be looked at that way. We live in troubled times. And we all know that, and it's getting tougher and tougher. So I don't want us to get tougher on taxpayers when the times are even tough. As long as the intent here is very aligned and to work with the individuals that are having difficulty paying the taxes, as you've already alluded to, with payment plans and as much, fairness as we can. And I think that's what's really important to me as a councillor in dealing with public taxation.
So through the chair, so we actually do work with the property owners right now already. And it would actually benefit the property owners to do it every 2 years. That way, whenever they come into their payment plans, for example, a commercial property, instead of going 3 years and then us coming up with a payment plan, instead of paying $3,900 a month, they will actually be paying, say, $2,800. Like their payments per month won't be as highly caught up if we start the process 1 year sooner. Exactly, so it does actually benefit the property owners as opposed to not benefiting them, and our end process is not to put people into tax sale, it's actually to work with the property owners to be able to get them into these payment plans and to actually get them caught up on their taxes in time.
Thank you.
Councillor Waterfield.
Yes, the report's rationale with regards to going from 3 to 2 years is very, very sound. And I think the whole communication piece to residents is just absolutely critical. And we're really good in terms of communicating and continuing the good work that you're doing. I think that this is a very appropriate transition.
Other discussion on the motion? All in favor of the motion? Carried.
Sorry, Brian just wanted to make.
Oh, sorry, Brian.
Yeah, I just wanted to note that we're gonna hold a clinic at the end of July to try and help educate people on the benefits of paying their taxes on a monthly basis on a pre-authorized plan, which hopefully will also avoid some of these things coming to fruition. So this is the first public notice. I think it's starting July 28th, we'll have staff on site to help people through that transition.
Okay, perfect. Thank you very much. 8.3 Ontario Trillium Foundation Seed Grant Program, Councillor Bolton.
Thank you, Deputy Mayor. Moved by myself, as recommended by the committee of the whole, we resolved the council of the town of Perth authorize the director of community services to submit a grant application to the Ontario Trillium Foundation Seed Grant Program for an upset limit of $100,000 for the implementation of further recreation programming and planning as presented in report 2024-CAL-8.3.
Discussion on the motion. Councillor McRae.
Through you, Chair, I just wondered, what are we going to be doing with the 100,000 we're applying for? And does this seed grant cover any staffing costs?
Through the chair, great question. It's up to a limit of $100,000. So that's the maximum amount of grant that we can receive. So I just used that number. I was initially looking into an option for utilizing the Mobile Y program for the YMCA in Eastern Ontario to bring programming for fitness classes to this area and utilizing that as a grant. It's actually not that expensive, and so what I'd rather do, you can utilize this to help with future program development, and you can actually use staff for it. So I'm going to explore the option of hiring, whether it's recreation program coordinator / volunteer coordinator to help us with some programming development that we can look at for future program development and utilize that as a salary for the grant.
Thank you.
Mayor Brown.
So, the whole situation as it is, let's say we got $100,000, what would be the first thing that you would like to do?
Sorry, what would I like to do with it?
What would be the first thing that you would like to do with it?
Through the chair, I want to continue to just finalize my research, but what I think I would do is use the hiring of a recreation program coordinator.
Councillor Waterfield.
Through the chair, if we're successful in getting all or part of this grant, would any of the recommendations coming from the Darrell Working Committee be contributed to that, or are you thinking about that being separate funding?
Through the chair, I just think it's too early on for the Darrell Farm Working Group because I think we're going to spend a few months putting this together. This is due next month, but I do see with the Ontario Trillium Foundation, they release new grants every year. So in the future, we can look at development opportunities for the Drew Farm, but specifically for this, I really would love to use it for staffing, and if it's just on a temporary contract basis to help us just ramp up our recreation program opportunities.
Okay, again,
Any further questions on the motion? All in favor of the motion? Carried unanimously. Before you move forward, the town with fire break policy, Councilman.
As recommended by the committee, of the whole be it resolved that the council of the town of Perth pass bylaw number 51XX, being a bylaw to adopt a fire break policy as presented in report 2024, committee of the whole 8-4.
Discussion on the motion or any questions for staff? Councilor Smith.
I think fire break policy is an excellent thing to do. If all we have to do is look back at what we last couple of years to new developments and how often there's been a fire that's taken out 20 buildings in construction. So with all the building going on that we are going to have, it's an excellent policy to adopt.
Councilor Waterfield.
through the chair. So reading the report, I just want to clarify, these fire break lots, would these be permanent or just during the period of construction?
Through the chair, they'd just be for construction purposes. So instead of doing 10 in a row, you might do 5, leave an open lot, do 5, and once they're finished, then you can finish that lot.
In terms of other construction?
It's more phasing in to prevent a fire from just ripping right through the whole 10 right?
Makes sense. I read it through twice and I wasn't quite sure whether it was more permanent or temporary. So thanks for clarifying.
Mayor Brown, was your hand?
Provision basically suffices, so if it was a new Jones Street going, then it would be asking them to do house 1, house 3, house 5 or whatever instead of house 1, 2, 3.
Through the chair, something like that, but it'd be more, it would be case by case, but more like 1 to 5. Skip 1, 6 or 7 to 10, something like that.
Councilor Bird.
Yes, if I may through the chair, it was really well constructed and very timely. That this has come forward, you know, I really appreciate the effort on this. Obviously.
Councilor Bolt.
Just a point of clarification, so for either one of you, so during the, if I'm the developer, I'm the builder, I'm gonna put up 40 buildings in a row or whatever. Is this negotiated at the time, you know, the actual lot plan or plan of subdivision, or like, what point is this communicated to the developer, and what does it take to get the developer to agree to?
Well, he doesn't have to agree to it if you pass this bylaw.
Okay.
This will be a policy that will be put into the various development agreements we have. I would suggest that for a larger development, we would sit down at the time of, for plan of subdivision condominium and say, what phase are you doing? What are you proposing? And work with them, following the guidelines as the policy. But my hope is, and when I started working here a couple years ago, I wanted to get policies working, and Trevor really wanted this one to go, and so he's really, really hard, going through this. But the intent is eventually to have a package for all the developers with all sorts of different things handled right at the beginning. This is our first evening, just kind of figure all this stuff out.
So if I could just a supplemental question, so I understand it. Well, I don't think it's a great idea, but Trevor, you mentioned a minute ago, it wouldn't necessarily be the same for every development. I mean, are you gonna have a kind of a template for so many houses, or are you just gonna do them on an ad hoc basis?
Through the chair, so there is a rough template based on if it's a single, if it's a town, if it's a multi, we have a basic template. And if, the way that the construction minimum makes sense, we'll work with the developer. And at the end of the day, the point of this is to be as transparent as possible. So when you're coming in, you know what to expect, and you know that we're gonna work with you instead of a surprise later on.
Exactly.
That's the intent.
Thank you.
Any further questions? Does this affect any development that's currently on your tables that either we've sort of passed off to site plan or whatever else? I'm not sure how far along some of our proposals are in the town of Perth, but are we going to sort of shock any developer who's to this point thought they were going to go ahead and do it a certain way and they've already planned their plan?
I have to go back and look at the wording. I know we talked about that. I think our best we probably couldn't enforce it because the policy hasn't been passed yet.
Yeah.
But we would certainly work with them and say, this is you know, of importance, this is why we're doing it. You know, please work with us, and I can't see. I work with a lot of developers and I've never had anyone push back against this particular, you see silly things like people storing construction materials on the lot in between. And then when you point out like that's actually an issue. But, oh, right, you know, so no one, because they don't want to lose their houses even on construction materials, so it's not a particularly contentious thing, I don't think.
Okay, thank you. Any further discussion on the motion? All in favor of the motion? Carried unanimously. 8.5, Cat Pound Services Agreement with Lander County Welfare Society, Councilor McRae.
As recommended by the Committee of the Whole, be it resolved that the Council of the Town of Perth pass bylaw number 51XX, being a bylaw to authorize the mayor and the clerk to complete a cat pound service agreement with Lanark Animal Welfare Society laws as presented in report 2024 Committee of the Whole 8-5.
Discussion on the motion. Any questions? Councilor McRae.
My only question has to do with costs associated to veterinarians. And I just wondered, when you talk about veterinarian expenses, they can be quite high. We have our upset limit of 4,000 annually for this service through laws. Do we have any indication from last year what we paid for veterinarian charges? Because they can be,
Through the chair, I have to go into records, but it'd be under 1,000.
Okay.
Any other questions on the motion? All in favor of the motion? Carried unanimously. 8.6, Dog Pound Services Agreement with Andrew Bond. That's Councilor McRae again.
As recommended by the Committee of the Whole, be it resolved that the Council of the Town of Perth pass bylaw number 51XX, being a bylaw to authorize the mayor and the clerk to complete a dog pound service agreement with Andrew Perrin, as presented in report 2024 Committee of the Whole 8-6.
Questions on the motion or discussion on the motion? All in favor of the motion? Carried unanimously. 8.7, bylaw to implement administrative voluntary penalty system, Councilor Smith.
As recommended by the Committee of the Whole, be it resolved, the Council of the Town of Perth, 1, pass bylaw number 51XX, being a bylaw to implement an administrative monetary penalty system, AMPS. And 2, direct staff to bring forward an amendment to the fees and charges bylaw to add administrative fees relating to AMPS once the required public notice has been completed, as presented in report 2024-L-8.7.
Discussion on the motion or questions? Not seeing any. All in favor of the motion? Carried unanimously. Report 8.8, yard maintenance bylaw update and repeal of bylaw number 4263, Councilor Waterford.
As recommended by the Committee of the Whole, be resolved that the Council of the Town of Perth 1 pass bylaw number 51, being a bylaw to provide minimum standards for maintaining yards in a clean and fair condition. And 2, pass bylaw number 4263-0 to repeal bylaw number 4263-yard maintenance bylaw, as presented in report 2024 Cal 8.8.
Discussion on the motion or questions, Councilor Waterfield.
Through the chair, when I read through the bylaw, and I'd appreciate perhaps if our CEO could bring that up on the screen. Specifically, I believe it was on page 131, 6.1.1. I just want to get clarification on that particular area. It talked about, I'm having problems reading that, but it talked about the fact that if somebody wanted to develop their front yard, and I'm paraphrasing, it would have to be within the character of the area. So my question through the chair to our clerk is, if a citizen happened to be living on a street and all the front yards were pristine lawns, and that particular citizen wanted to put a vegetable garden in their front lawn, would the wording of the proposed bylaw prohibit that?
Through the chair, no, we wouldn't.
It would not?
We work with property owners, as long as it's not causing a safety issue or it's encroaching onto sidewalks or deterring people from being able to use public space and that kind of thing. We would work with the property owners on that.
Well, thank you for clarifying that, because when I read it just seemed quite subjective to me, and that was the specific example I was thinking of, because I've had a number of citizens bring that particular issue to my attention, so thank you for clarifying.
Councillor Smith.
Right now, I know of several places where the grass is more than 8 inches tall in front yards. Is there any possibility of having the bylaw officers just drive around, have a look, and hand out some tickets?
Through the chair, yes, that's the process. They are in the process of doing that right now. We've met this week and reviewed properties, and they are constantly out on patrol. And we use several different processes before we start anything to do with bonds or charges or anything like that. So we start with we have a door hanger process, and that's a very effective way to we are constantly looking. Yes.
Further discussion or questions on the motion? All in favor? Carried unanimously. Report 8.9, support the Chief Administrative Officer and nomination of Association of Municipalities Board of Directors. And that's moved by Mayor Brown.
Funded by the committee of the whole, be it resolved that the council of town of River support the nomination of Michael Tao, CAO, to the small urban caucus of the board of directors for the Association of Municipalities of Ontario, AMO, for the 2024 to 2026 term, as presented in the report 2024-8.9.
Discussion on the motion. Any questions? No, all in favor? Carried unanimously. Any questions for the CEO or directors, or does anybody from staff want to highlight anything from their reports that you think we really should understand? Councillor McCray.
Okay, so this is for Kathy McManamy, Community Services. First of all, I just wanted to say I think everybody is very, very pleased with the Crystal Palace. Great job. Oh my goodness. It's done very, very well. Second thing is, will the picnic shade that's in Perthmore, is that going to be removed and then the new playground structure installed, or are both going to be there?
Through the chair, they're both going to be there. So it was through a grant that the town received. And so part of it includes the construction of the picnic shelter. And then the playground is going to be installed this August. So they'll complement one another for families to picnic there. And then the children can play, adults can play too.
And we're also going to have a replacement on Mill Street. And it says the original is going to Crystal. Explain that.
Yeah,
I thought that was interesting.
Through the chair, we did a request for proposals, any interested parties to provide the removal, and they can then own the playground property. And so we received 2 proposals, and one was from the town of Prescott. So they just recently developed their new community center, their arena, and on the outside of it, it's going to be an outdoor recreation complex, think similar to Common Farm, which would include soccer fields, a playground, as well as baseball diamonds and a tucker. But at this point, they know that they can't continue on with the capital project at this point. So they were trying to look for a creative way to bring in a playground. They saw a proposal. So they offered us $1,000, and last week they did the full removal. And then what they're going to do is put a plaque in the playground, and they install it within the next 6 to 12 months, thanking the town for their contribution. So it was a great partnership.
I know that you work quite extensively with the BIA, which are doing great things like the kickoff to summer. Just learned yesterday that the permit coordinator is leaving the position. So, is there anything you wanted to say about that?
Through the chair, Kelsey Dole did give her notice that she will be done at the end of July, which we're sad because we've had a really great collaborative relationship with the BIA. Kelsey's been a great leader with them. But she is staying on past the Stewart Park Festival, so we're all very grateful for that. And then she is going to be launching her own business in downtown Perth, so we wish her all the best.
Councillor Barfield.
Through the chair, a number of questions, building on the question that Councillor McRae asked you about the Mill Street parking lot playground equipment. I had a citizen approach me a few days ago and I suggested he email you directly, and I'm paraphrasing, but the question was, since there was still use left in the playground equipment, why didn't we relocate that to another part of our town as opposed to having it bidded on and going to another town?
Through the chair, it's a good question. A playground's lifespan is 15 to 20 years, and this was a 17. So while it still looks like it's in good condition, we do annual inspections, which they always pass, but we have put in some investment into the play structure. So its demise will occur over the next few years, and Prescott's only using it as a playground to use for the next few years until they can afford a new one. So to install it to put in the time and effort into installing it in a new area wouldn't help us in the long term from an operations standpoint.
Okay, thank you. A couple of other questions, if I may, Mr. Chair, to our CAO. What are the next steps and timelines with regards to the Fulton Street Affordable Housing Project? You mentioned that in your report. I'd appreciate a little bit more information.
Through the chair, the council has passed the sale agreement, so it's just a matter of working through the legal process for that. And then I assume that they will begin the planning application process.
Okay, super. Thank you. Just a quick comment to Grant Environmental Services. I have my second cup of coffee every morning walking along the Tay River between Beckwith and Craig. And thank you for installing those 2 garbage cans. So that means I won't bring as much litter back to my house. And last but not least, to Trevor, in terms of protective services, I noticed there were 2 vehicle collisions. Do we keep stats as to where these collisions are taking place, and do we look at trends? I'm curious where these 2 particular ones were, for example. I'm thinking of a couple of intersections in town that I personally am concerned about.
Through the chair, yes, we collect our data, but we get called maybe 1 of 10 of collisions in town, so your OPP would be the wrong place to get those statistics.
Okay, fine, thank you.
Councillor McRae.
To the chair, and this is for Trevor as well. So, how many times are people warned before they are issued a $360 offense for unworking smoke alarms?
Through the chair, once. Yeah. So, and we're looking at different ways of how we're gonna move forward, whether we're just gonna waive that and just start finding people immediately, because that's kind of what we possibly should be doing. But right now, you know, for the most part, education is what people need. They don't know that if it's their responsibility, or if their landlord's responsibility, or if they're on home, how many they're supposed to be. You know, we try to push that messaging out. We're just not reaching as many people as we'd like. So that's the challenge on our plate. It's the challenge across the province. They're all municipalities that are facing the same issue. So we're going to keep trying new things, and hopefully we can get this message across.
Any other questions? Kathy, just one for you. Last summer I was asked by somebody, why weren't we trimming along the water's edge in Stewart Park, since it's more of an ornamental park rather than natural settings? And I didn't have an answer, and I don't know if we're doing that this year or not, but just because I figured I'm going to get hit again with this one.
Sorry, why aren't we trimming it?
Are we trimming the water's edge in Stewart Park, or do we want to go so close to the water's edge and let it grow naturally?
So when I started last year, the direction was that we were leaving it to be a natural edge. However, I did ask staff to landscape the island in a better use because it is used, by people to be able to go across. And so it's more better utilized, but along at least the shorelines, we still have, wildlife, it's utilizing it. So we want to make sure that at least it's a space that it cannot be too obstructed, but we do manicure it up until that.
Okay, thanks, that's a great answer. Any other questions from council? No? Okay, thank you. So our next meeting is next Tuesday, June 11th at 5:30. Any questions from the media?
Not.
Okay, so no closed sessions. Councilor Waterfield, motion to adjourn.
Move that committee of the whole meeting held on June 4th, 2024, adjourned at 7:25 p.m.
All in favor? We're adjourned.